Well, major political parties often run what are known as focus groups. They pay research companies to find out what voters are thinking and feeling, and they use that to shape policies, messages, and ultimately win elections. Joining me live now is the director of RedBridge Group, Simon Welsh. Simon, what are you picking up in the groups this week?
Yeah, g'day, Laura. It's been a week sort of focused down in Victoria, and particularly we've been speaking to folk around health and health crisis, and particularly the Victorian Liberals announcement around the suburban rail loop cancellation to use that money to fund into hospitals. And it's kind of in a way been a week of confirming something that we've sort of been saying to folk for a long time, which is we've been finding for years now, and this is well before COVID, that political parties need to be really careful about how they talk about hospitals and hospitals funding, because just about every group we do, more than half the group will have an experience of long wait times in EDs, of not being able to access the specialists they need in hospitals. So there is this kind of healthy cynicism in a way around sort of hospitals. So you have to be very careful about how you talk about it. So what we've seen in this past week is the Liberals' announcement has really push this narrative of, well, how are they going to staff it? So for viewers outside Victoria, they've promised to build a whole range of new hospitals using funding that was allocated for the suburban rail loop project. And particularly the persuadable voters. So, of course, there's a bit of a breakdown party lines in terms of that proposal from the Liberal Party, but those persuadable voters in the middle are sort of saying, well, how are they going to staff it? So that's really been the issue of the last week. It's put sort of the spotlight on that aspect of the crisis. And then, of course, this over the weekend, which we haven't had a chance to test yet, the Andrews government has come out and put forward a proposal for how they intend to staff it with free university courses for nurses and midwives. So I think the way it's flushing out here is that the Victorian Liberals may have made a bit of a tactical blunder in pushing this health issue and pushing the sort of the public debate into very healthy territory, if you pardon the pun, for the Labor brand.
Well, it wouldn't be the first blunder the Victorian Liberals have made in recent times, particularly off the back of a pandemic. And this is a post-pandemic election with Daniel Andrews, and many voters would be frustrated with him. But it seems that he's still going to get over the line where we look at it from here. And the views on both leaders and their qualities hasn't shifted.
That's right. It's really remarkably stagnant in some ways. It's the views on Daniel Andrews haven't changed much since the end of the pandemic. If you hated him because of lockdowns, you still hate him. If you loved him because he looked after Victoria, you still loved him. If you're somewhere in the middle, you're looking at him and going, well, here's a guy who gets stuff done. He builds stuff. He gets on with it, which is pretty much where we were in 2018. So that really hasn't moved much, and we're still picking up issues around sort of trustworthiness and relevance around Matthew Guy. So it's in a remarkable kind of way, apart from those sort of two edges of around the pandemic perception, it's almost like back where we were in 2018.
Seemed like it. We'll see for sure in just a couple of weeks' time. Simon Welsh, good to see you.
Thanks, Laura.